Hi folks, Mike Protack again, talking about some issues important to the state of Delaware and to our country. And again, we're going to take a look at health care. The public option is something that's been talked about quite a bit. It's starting to grow some legs. There's some formative legislation out there right now. So let's take a look at how things are shaping up as we know it today. Now, the public option is a moving target. I think we've said that before. It's somewhere between $1 trillion and $2 trillion, which is, even in Washington, is a lot of money, because you and I are going to have to pay for this. Now, the key thing we need to worry about when you're talking about the public option is how much will it cost? We just said that. And two, how are we going to pay for it? Now, the key thing to understand is health care is not free. Just because the government is the central formative person doing it, or entity providing health care, it doesn't mean it's free. It means somebody's going to pay for it. Right now, the only way the president or the Washington politicians have a way to do this is going to be tax increases. It is really just that simple. The president has mentioned to take $300 billion, again billion, that's a lot of money also, away from long-term costs for Medicare, which is a way of cost shifting, which is one of the things we've been trying to avoid with private health insurance, and the president wants to do it, of course, with the public option, to take some of that money to make it a little bit less onerous. But in the end, you still have somewhere maybe $1.5 trillion we have to pay for somehow. And again, that's going to come down to raising taxes. It's just that simple. You can't bring more people onto the rolls unless you're willing to reform Medicaid and Medicare to some degree without it costing a whole lot more money. And economics is very simple sometimes. It's easy to ignore, but you end up paying a whole lot more. And again, let's go back to the public options, as Medicaid and Medicare are often called. Without reforming those two programs, which take an awful lot of money, and it's quite amazing, you really lose sight of just how important it is. When Medicare was first envisioned back in the mid-60s, it was going to cost between $10 and $15 billion a year. Well, we're up over we've almost 20 times that much now. So it has lost sight of its original focus, and that's unfortunate. In fact, the precise number, I think it was about $7 billion in 1970 were the cost, and we're somewhere now, I think it's $225, $230 billion. So maybe the 20 times is not quite accurate, but it's gone up exponentially, and that's something we simply can't afford. So for those who think the public option is some way of giving people more options, it really is a way of increasing taxpayer burden. And again, you bring Washington into the equation of who decides what kind of health care, what kind of quality. It limits your choices. It will limit your doctors. Anybody who doesn't think that's a reality is missing the point, just like Medicare does. Medicare is full of restrictions, it's full of guidelines, and again, the only reason it stays in business is because it pays providers and physicians less money. Same with Medicaid. And Medicaid's a program that's growing somewhere between 12 and 14% a year. So I think most people would agree the public option has great intentions but very poor execution at this point. And I'll tell you how skewed it can be. And these are real numbers here. Senator Ted Kennedy's been working on this issue for many years, and thank goodness his work hasn't progressed too far when it comes to money. He envisions having subsidies, and get this folks, 5 times the poverty level for a family of 4. That's somewhere around $110,000. So he envisions having subsidies, that's a nice way of saying taxpayer money, to make it affordable for people to buy the public option. So again, the interest is there, it's a good idea of merit, but in practicality it simply can't work. And we only have to look at Medicaid and Medicare. And I'm not against people having health care, or universal health care if we do it right. But the public option essentially is a way of raising costs, lowering quality and quantity at the same time for physicians, and not making a whole lot of sense. We can do it a whole lot better. So let's think about that. Stay tuned. We're going to talk about single payer option next. Our friends at Delaware Liberal have brought that up, and we want to answer that question also. So stay tuned. Thanks for listening up.